I'm Matthew Milowsky. I am the Section Chief of Genitourinary Oncology within the Division of Oncology in the Department of Medicine at UNC Chapel Hill. And I made a decision to go into the field of genitourinary cancers due to the fact that there was a clear need to develop new therapies for patients with urological cancers, including bladder, kidney, prostate, and testicular cancer. And so my role is to care for patients, to do research, to develop new therapies, and also to teach, to ensure that the next generation of trainees in oncology are able to provide outstanding care and deliver even better therapies to patients. Looking back, in medical school and going through rotations, there were a number of specialties that were exciting to me, but there was just something about oncology and patients who were diagnosed with cancer that was particularly appealing from the standpoint of being able to really have a relationship with people over time, and also to be able to, again, in recognizing the fact that we don't have the most ideal therapies for many patients, to develop research opportunities to be able to find better treatments for patients. And so that combination of the ability to see patients over periods of time and develop relationships, along with developing therapies that can hopefully be more effective in treating them, was what was so appealing for me. So I've always thrived at academic medical centers because not only do I love caring for patients, but I love research and I love developing new therapies for patients. Unfortunately, as we know, although there have been some absolutely amazing developments in the treatment of cancer over the past several years, we still continue to need to do better. And so the development of new therapies through clinical trials and translational research, where we actually go from the bench or the research lab to the clinic, and from the clinic back to the research bench, is a major part of what we do to be able to provide the best possible treatment options to patients. When I first came to UNC, I ended up in sort of the basement of the hospital, wandering around, and found myself speaking to one of the maintenance people in the hospital, and I was lost, and he could tell I was lost, and he said to me, "Can I help you, Doc, find where you're going?" And I was going to the emergency room, and he said, I'll show you. And I started to have a conversation with him, and I said, "So how do you like your job?" And he said to me, "Well, I don't love every part of my job, but I really love the ability to know that what I'm doing is helping to care for the people of North Carolina." And I'd never heard any sentiment like that before in other places that I worked. And I think that there really is this genuine feeling that we are providing care and helping the people of North Carolina.